You are now listening to a family live session. This conversation has been recorded as an extension of a previous podcast episode or as a Q&A tackling a topic that has been voted by the listeners. The guests have tuned in live to answer questions from the viewers. If you want to know when the next live Q&A session happens, follow us at Family Podcast on Instagram, Facebook, or LinkedIn. Thanks for tuning in. It's great to see that you guys are tuning in. We have Lisette de Jonge today joining us from IKEA. And as you all know, we had a very nice podcast episode about well-being shared last week. And Lisette was so kind to join us to discuss more about well-being and health at work. So feel free to ask your questions because she's here to answer them. Lisette, welcome. Such a pleasure to have you here.
Thank you very much. Nice to be here.
Thanks again for tuning in. I know this is, it's nice to have, again, an interaction with the people that have listened to the interview that we did together. And you talk about a very important topic, which is well-being at work. And it's also a topic that is not really or wasn't really tackled before as much as it is now. And people have questions about what does it mean to be in this role, how do you do your everyday job, and so on. So I would like just to start with a reminder of what is well-being. How do you define well-being?
Yes, well, actually, health and well-being, we can define it in the work setting, but also outside the work setting. So when we talk about health and well-being, it's a state of mind and how you feel, and if you feel healthy, if you feel well. So it's actually a very broad sentence when we talk about health and well-being. So when we talk about health, it's more the absence of sickness. And when we talk about well-being, it's more a mental state.
And well-being at work. What do you think it's well-being at work? What do you define as well-being at work?
When I look at my own work area, then I think it's really also a broad topic. Because it's containing the work environment, but it's also containing the private environment of our co-workers. So when we talk about well-being at work, I think it's really about how co-workers feel within the work environment, but also knowing that the private environment is influencing their health and well-being at work.
Mm-hmm. And we had some feedback about the fact that you within IKEA have a very cool role, so to speak, because it's something that showcases the values of the company. Is there any feedback that you received regarding your role and what people think about it and how do they see it in their own organizations?
Yes, I actually got a lot of feedback or a lot of comments on the podcast. Many people were very surprised about the role, as it is quite a unique role within the organization. And I got also many questions from people who asked me how I got there and how they could also maybe get a bit more into this direction. And then it's more like from a perspective of helping co-workers, also co-workers who are absent, and also people who had a mental challenge themselves. For example, people with a burnout, and they got better, and now they are really interested to help other people preventing a burnout, preventing mental diseases or challenges. So it's actually, the questions were coming from all different angles, but very, very interesting.
Mm-hmm. So let's talk about well-being at work and how did you get there? You said that you created your role for yourself in a previous organization. And you switched from focusing on absenteeism as, the key role of well-being to actually extensive well-being at work that includes emotional, financial, social well-being as well. Can you tell us how was this transition and how did you start? I don't know, some of the maybe details of how do you get to have this sort of role within an organization? And like you said, people asked you, how did you make it here? Can you tell us more about the journey itself, some of the key points of becoming a well-being leader?
Absolutely. Well, I think when I started with my work focusing on helping absent co-workers in the organization I worked for at that time, I noticed that, of course, it's really important to try to help co-workers getting back to work and let them feel better. But what we realized when we were looking at more a data perspective on health and well-being, that we saw that we could influence the positive part a lot better than the negative part. Because within organizations, of course, there is only a small percentage is absent, but the biggest percentage is still healthy, and most of them are feeling well. So from my perspective, it was really interesting to focus a bit more on the healthy people. And when we connected the social part and the more emotional part of helping co-workers with the data part, then it became really interesting. Many people were more and more interested in checking their own health and well-being. You saw many people, and still see many people, wearing those wearables, tracking their own health and well-being, for example, with sleep, tracking heart rate. Also now with intermittent fasting, many people are really aware about their own health and well-being. And we try to connect from the organizational perspective with the personal perspective, the data part. And that made really the shift from focusing on absence to more health and well-being, to see if we could influence the health and well-being of the co-workers, and then connecting it to, for example, absence, for example, connecting it to productivity, protecting and also protecting the health and well-being of our co-workers. It made a real shift within the organization, and also in other organizations as well.
And when it comes to your career path, can you tell us more about what were some of the, I don't know, key decisions you had to make in order to get to this position of being a well-being leader? What were some of the, I don't know, steps that you encounter, and what would you recommend those who want to follow in your path?
Yeah, first, when I started to work within the field of absence, it was a bit of a negative area within the organization. Many people had a really negative thought about absent people, how to get them back to work. It is also, quite often it's quite a hassle from an organizational perspective, but also for co-workers themselves when they don't feel well. From that perspective, I found it really interesting to help those people, but also helping the organization to improve the absence management, and then making the shift towards health and well-being. I was really interested in the data part. So I think when people are interested in working in this field, from my perspective and what I see in the outside world, is that there is a shift going to a data-based or data perspective on health and well-being. So when we talk about health and well-being, try to have a return on investment, try to connect the dots with data to see if your initiatives that you are rolling out could improve actually also the organization's figures.
Data, yeah, that's the, let's say, hotspot of now making decisions. And of course, it's going to become more and more data-driven. We already see a lot of data-informed decisions being taken. And I would say that historically, this topic of well-being wasn't really correlated with data. So because you've mentioned it, is there any particular, I don't know, setup that you've created in order to be able to find numbers on those sort of aspects? Because how do you measure well-being at work when it's, it's about the context, it's about how you feel and how you, the stressors that you get from the outside world. How do you connect that to actually make a report, for example? What do you look at?
Yeah, it's quite interesting topic, because health and well-being is a perceived way of feeling. So how do you feel? It's really the question, if you ask that to people, that that's really personal, and maybe you feel one day you feel really good, but it's also depending on so many factors. So it is a challenge to measure health and well-being, but we have and there are many fact-based and research-based questionnaires rolled out in the world that you can actually test health and well-being or measure health and well-being, and that's also what we use. It's only based on research, and I think that's the only way to measure and then connect the dots and see if there are any correlations.
Mm-hmm. So we got actually a question here: how do you measure the data? And you said that you use research and surveys. So there is basically this, research approach of looking at asking the right questions and analyzing the answers and putting it into a bigger picture. There's no other shortcut for it.
No, and unfortunately, it's also a bit of a long-term aspect, because you cannot immediately see the effects of an implementation of a certain initiative, because when you roll something out, it will take some time to have a certain effect on people. and then still it is a perceived way how they feel. So it's a bit hard, but in the end you can measure. Yes.
Yeah, it's the long run of getting something out of the initiatives that you implement is not immediate.
No.
Very, very, very interesting. And we got another question. Do you think companies are now ready to hire well-being managers for their employees, or at least start well-being programs for them?
I absolutely think that. I see that more and more coming into the world, that many organizations are more focusing on the positive part of co-workers' health and well-being, and not only focusing on absence. But what I also see that many organizations are still having a focus on health and safety instead of health and well-being. And I think that those areas should be integrated with each other, and then the shift will really come.
Can you share a bit more about the different dimensions of well-being at work? What do you think it's well-being at work? I don't know,
Yes.
related to, for example, what you do at IKEA, or how do you go around that?
Yeah, it's not specific, my opinion, on the areas of health and well-being, but there is also a lot of research done around this topic, and many organizations have a different perspective on which areas should be included in the strategy and which areas should not be integrated. But areas you can think of are, of course, the physical health and well-being. For example, when you talk about nutrition, when you talk about sleep, which are really influencing aspects of the total health and well-being. Then you can think of mental health and well-being area. But also, for example, when you talk about spiritual health and well-being, is often an area that organizations are focusing on more and more. Social well-being is an area that many organizations are focusing on. Financial well-being is also an upcoming area. So it's up to the organization and the kind of organization that people work for and what is really fitting for them.
And when it comes to you, I would be curious to know more about how do you integrate well-being also in your personal life? Because you said that a lot of people wrote you about the role that you have at work every day. But I'm sure that, you mentioned also in the interview that you also have to take care of your personal well-being, and you yourself sometimes feel stressed. How
Yes.
do you cope with that? And how do you integrate well-being in your personal life?
Yeah, they also say, of course, practice what you preach. And of course, for me, I have my challenges as well. But I do work out a lot to clear my mind because it's quite a hectic role which I have, and I get a lot of energy out of this role. But I also feel it's really important to disconnect from work when it's needed, to take some time for myself, to go into the nature. But what I also see, and that's also being shown in literature, is that you need to have a bit control about the workload you have. So when we talk about the demands you have at work and then the control, it should be a bit in balance. Because if you don't feel that you're in control of the workload you have, then you can feel really overstressed. And sometimes, of course, I have that as well when the emails are coming in and the projects are still continuing. But then feeling if I get a bit more control of the workload and talk about it with my team members, then I really feel it can be a relief, and that you are a bit more relaxed by yourself. Another area where you can influence your stress level is breathing techniques, and this is also something I use myself. So sometimes I'm just using the app or my watch, where I have a Garmin watch where you can just have a breathing technique as an exercise, and then actually I feel better when I finished it. So actually I use many different examples of my own area.
The moment you said breathing technique, I just took a deep breath. I was like, this is the moment, a reminder of doing that. And I've had a couple of interviews where we've discussed mental health and well-being and, career versus life, and how you should always put yourself first in order to perform in any aspects of your life, because otherwise you're always getting there with half a glass empty. And you think about, it's half a glass full, but then the rest is empty. So you really need to, push even more to make it happen. And I'm happy you mentioned this, because we got some very nice feedback on the resources that you've shared of how you integrate well-being in your life, and you gave a couple of podcast examples and so on. And I would want to ask you on that note of resources, is there anything else that you feel you want to share after you've gotten the feedback? Because like we both discussed just before starting this call, it was quite surprising to see that people found it very helpful just getting this sort of advice from somebody that practices or uses those techniques. And is there anything else that you want to, I don't know, share now that we know people are really interested in those topics?
Yes, I got a few messages on LinkedIn from people that they could also advise some other podcasts. So it was really nice to hear that people were listening to the podcast and they thought there were podcasts that they didn't know, so they tried them out. And then I got some other advice from them, which could be interesting for me to listen to as well. I can share them afterwards. I don't know all the names now by myself, but I can do that. And I also got some questions from some people that they say, do you know any apps that are free? For example, yoga apps that you should not pay for some students. And I think that's an interesting part as well, because of course we all want to work on our health and well-being, but we don't all have the money to download all the apps that are paid for. You need to pay for. So I think, from that perspective, we can share a little bit more tips and tricks from free apps.
Yeah, very, very, very good point. And you made a very important note here on how is well-being represented in our discourse, because we've shared this sort of interview on Facebook, we shared it on Instagram, we shared it on LinkedIn, and you got different sort of feedback from different sort of channels, right? Like I get as well. And it's quite interesting to see that this field, it doesn't matter what your main objective in life is. Well-being, it's a general a setup and topic that we should all be looking at. And I would want to ask you on that note, if you've had any, I don't know, realization after our interview of, well-being and what your role entails. I feel like having a role of well-being, it's really new, and it's also, it sparks a lot of curiosity. So is there any realization that you've had after getting all the feedback from the listeners about the things that you've shared?
Yeah, I actually had, because I got some questions from people with children, and they asked me how they could educate their children already in this topic, because the schools are not really focusing on mental well-being or financial well-being. And it's so important that we educate our children already on this topic, because if they start studying and then afterwards they start with the work, there will be many challenges and they have not been educated on this part. So I think that was one of the surprises I had, that I thought maybe we should start earlier already with educating our children on this topic, and give them already some tips where they can think of to be in control of your mental health and physical health and financial health, because it's so important.
Definitely. You have a very important point there with parents, and parents who are aware of the way that they want their children to grow up and maybe not go through the same challenges. And they also see the impact of technology, for example, that it takes on their life. And it's a very, important point. Somebody said, kids' education is a very, very good point. And we also got a question here that I think it's very, very relevant to where we live, because in Denmark and Sweden, well-being is important, but in other countries, I think it is unfortunately less present. How do you think employees could start raising their voice and ask employers to invest more in this area?
Yeah, I think Andrea is right with that, and that's very unfortunate. But it's also, it is culture depending how you're raised, and if, for example, mental well-being is a topic you can easily talk about with your friends or family or employer. And I do think it's very important to open up towards your employer about your mental well-being. And I think the only way you can do it is find some honest conversation, a time to have an honest conversation, for example, with your manager, and ask if you can trust this person, because it's a very sensitive topic. And that's the only thing, from my perspective, to open up the conversation and start talking.
It's definitely a bigger conversation than just us starting it here, and the fact that I managed to have a leader in well-being in my podcast sharing all these insights for me was already amazing, because I know that a lot of people will listen and they'll be like, yeah, this sounds good, but how can I implement this? So I would say, is there anything that from you implementing a well-being strategy, are there any findings that you consider we should all be aware of? Like something that, I don't know, you didn't expect it to happen like this, or you were very surprised by the result. Is there anything that we should tell people about, what does it actually entail to share a well-being strategy?
Yeah, that's a bit hard from an IKEA perspective, but what I think it's really important is that the top of the organization should be really engaged to have this topic being covered in the organization, because I do think if you start bottom up, it will be really hard to convince the top management that you should have a health and well-being strategy. So I think there should be a lot of support from everyone in the organization from a leadership perspective to be able to change something in the organization. But then if you focus on, for example, data, which helped me a lot, I do think you can have a good business case to convince the management team that health and well-being is very important in an organization. And as we all have some challenges sometimes in our lives, it's really something, it is a topic that everyone actually can talk about. Everyone have some stress sometimes. Everyone needs to, especially in this COVID time, need to have the challenge with working at home, having private challenges, having work challenges. So it's really recognizable for everyone that you should focus on your health and well-being and stay healthy and able to be productive at work.
Definitely. I want to go back a bit to your career and talk a bit more about advice on that path, because like you said, a lot of people approached you about building a career in this field. Is there any advice that you have for them where to start? Are there any courses, or is there any, I don't know, sort of a resource that you think it's important to start with? Because when you think about it, you work still in strategy. So is there anything that they should be aware of, even if it sounds cool to be a well-being leader? What does it actually entail in the day-to-day activity?
Yeah, I can only talk for myself, of course, and my background within business psychology. And the people I talk with who were interested to work in this field, they all have different backgrounds, from a business background to facility background. So I think it's very important that you have a passion for the topic, and I do think it can be good if you have some experience by yourself with mental expertise or with mental challenges you had yourself, and you know what helped you, so you can help other people as well. But I don't think in this area is one specific way you could or you should take to become a health and well-being specialist. I think there are many areas you could have been working in before to become a specialist in this field.
That is definitely encouraging for some of the listeners who maybe thought they have to have some sort of degree or formation in this setup. So you're talking mostly about being passionate about the subject, and also maybe doing some research on your own to see what it entails and so on. And that's a very good point, because I always look up to people that have a passion for what they're doing, because it's just you see that through their work, and it's very encouraging to know that it's the way to go. I would also want to ask you if you if you ever received advice, what was the best piece of advice that you've received that stayed with you in your career?
Oh, that's a hard one. I do remember that an old manager of mine, she always said, never judge a book by its cover, but it's a bit of a cliche thing. But I do think it's very important that you look a bit further than the first thing you see. So dig a bit deeper. Also, when you think about your own career and the next steps you want to make, don't think you could not do it because you have a certain background or you have a certain expertise. I think it's really important, as also what you said, Alexandra, that you show your passion, you you're capable and just go for it. Because I think all the organizations just want to have someone working for them that is really passionate, that's really engaged. So I think that's really important.
Definitely. We got a comment here. I wish consultancy companies and not only would focus on well-being a bit more. We simply need more of you, Lisette. That was the that was the message. Looking back, is there anything that you would have done differently?
From a career perspective, you think?
It can be both. I don't know if there's any realization of like, if I knew this, I would have maybe done things differently.
Yeah, I think I'm sometimes very impatient on the things I want to implement. So I think when I look back, maybe I could take a bit more time on the positions I was at that moment, and then making a next step. But I was just very impatient, and I just wanted to go. And in the end, it was not bad, because now I have a really nice position, and I'm really happy about it. But maybe that's the only thing I could also advise to other people: be a bit more patient.
Definitely. Patience is a virtue, like they say. And I think it is, if I look at just the last 5 years of me living in Denmark, for example, I feel like the moment I relocated, and you did the same, now you also live in Denmark, I just had to do everything in the first year, like the friends, the right setup, the right company, work-life balance that they discuss here a lot. I just had to have it from the first year, and the culture shock that came with that was just huge. And I feel that if there is something to also consider for those of our listeners who maybe live in a foreign country, or are now stuck somewhere, or they feel like they want to change something, but they cannot at the moment because of the pandemic, to remind them that, being patient a bit more can really go a long way, and that it's important not to put all of this stress on them right now, because it is, the times that we're living are really strange, and it's not easy.
No, I totally agree. And I think especially what you said about the well-being, if you are very ambitious and you're really perfectionistic on the things you want to achieve, then it can be really stressful. And I don't necessarily think that could improve the things you want to realize. So I think sometimes a bit more patience could improve your goals.
Definitely. We're getting close to an end, like half an hour just went by. And I want to ask you if you have any last pieces of advice that you want to share with those that are tuning in and those who will listen after.
I think because this field is still a bit an undiscovered area, that it could be good if there are any people working already in this field of expertise, that we could connect with each other and see if we could help with each other, because I think it's really nice and fun, and we could improve this field, I think.
So this is an open call to create a well-being leader network. So everybody who's listening, add Lisette on LinkedIn, and follow her journey, and let's connect here and make a network that will really help us. We will of course share some of the tips here that we've mentioned. After this episode, we will create some social media posts, so make sure that you follow us on Instagram, Facebook, and LinkedIn, where we are very, very present. Lisette, it was such a pleasure to have this Q&A with you. I thought it was really fun to interact again, and I really hope that you've enjoyed this call as much as I did.
Yes, thanks a lot. I enjoyed it as well.
I hope you felt inspired to take charge of your next career move. Remember to review this podcast and share your comments. Thank you.